Today we're going deeper and deeper. If you've treated yeast infection over and over again and it keeps coming back, then this episode is for you. Hello guys, welcome to Nurse Juanita Dey Talk. Sometimes what looks like a simple yeast infection is actually your body signaling you that there's something wrong with your vaginal ecosystem, or that something in your vaginal ecosystem keeps getting disrupted. Now, for some of us, we think or assume that yeast infection is yeast occurring or appearing suddenly in our vaginas. But having known today that yeast is in everybody's vagina. Yes, but in controlled quantity. That's what I'm going to talk about now. So like I always say, the vagina is not a sterile place. The vagina is a controlled ecosystem. It's a controlled ecosystem. Now, in your vagina, you have good bacteria. These good bacteria, they maintain the pH of the vagina, keeping your vagina acidic. Now, this acidic nature of your vagina is the reason why yeast is under control. And if these good bacteria are disrupted, yeast will overgrow. Yes. So now yeast infection is not necessarily about the presence of yeast. It's the fact that the protective barrier of your vagina has been disrupted. Do you get? Like I said, the vagina is acidic in nature. Is acidic. That's why when you wear your panties for a very long time, that surface where your vagina comes in contact with your panties, it gets discolored. If it's black, it will bleach it. If it's other color, it will definitely change color over time. Yes. So is this acidic nature of the vagina caused by the good bacteria that keeps yeast in check? So yeast infection is not just about yeast appearing. It is the fact that your vaginal protective surface or your vaginal protective agents are being disrupted. Now, for those of us who have 4, 5, 6, 7, 8 episodes of yeast infection in a year, I have come to reassure you that your body is not failing you. If we should trace it, there's usually an identifiable pattern. Yes. Now, the question now is not, how do I treat it? How do I stop it from recurring? The question now is, why does the environment keep favoring yeast infection? Why does the environment keep favoring yeast overgrowth? So we're going to be diving into some of the causes of yeast overgrowth. And number one on the list is antibiotics. Yes. Remember when I said in the beginning of the video that we have good bacteria down there that helps to keep candida, which is yeast, in check? Yes. Now, when you take antibiotics, the antibiotic does not really know which one is good bacteria, which one is bad bacteria. Bacteria is bacteria. So by the time you take antibiotics and it reduces the efficacy of the bacteria, the good bacteria down there, what do you think will happen? Yeast will have room to overgrow. Yes, that's why sometimes when you experience yeast infection, it's usually maybe after you've taken antibiotics, maybe after you've completed an antibiotics dosage, then you notice that you start having yeast infection. Now, for those of us that abuse antibiotics, this is one of the reasons why you keep having recurrent yeast infection. You just feel some more itch than them antibiotics. You go meet man antibiotics. So this is me saying that the fact that you're misusing, and one of the reasons why you're having overgrowth of yeast is because of the fact that you are misusing antibiotics. Now, number 2 on the list is glycemic environment. Yes, high sugar environment. Now, you see this yeast-causing organism, Candida, it thrives in glycemic environment. It likes sweet things. Yes, so you don't necessarily have to be diabetic, because now that I've said glycemic, some of you are already thinking, oh, it's fully for diabetic patient. If you're someone that take high sugary drinks, high sugary foods, you are likely going to invite candida. You're likely going to encourage the overgrowth of candida. So if you're someone that you eat a lot of sugary things, try and reduce it. Once you notice that, oh, you're consistently having yeast infection, you're consistently having yeast overgrowth, try and reduce your sugar content so that candida will not see any place to thrive in. Number 3 is hormonal influence. Now, there's this particular hormone in our bodies. Yes, estrogen. Estrogen increases glycogen content in vaginal cells. Yeah. And like I said, glycogen, sugar, yeast like sugar. You understand? So when estrogen levels are high, during pregnancy, during our menstrual phase, during our ovulatory phase, yes, we tend to be prone to overgrowth of yeast infection. Yes. So that's why you see most pregnant women, they complain of yeast infection. Sometimes during your ovulation phase, you tend to have yeast overgrowth. Number 4 on the list is occlusive microenvironment. Now, yeast doesn't just like sugar. Yeast, candida, likes wet environment. Now, if you are someone that wears tight clothing, tight underwear, non-breathable underwear, or you stay in wet clothing for a very long time, those are environment that yeast loves. Once there is moisture, it goes there. You understand? Now, note, tight clothing alone does not cause, tight non-breathable underwear does not cause yeast overgrowth alone. It works hand in hand with other factors. You get? So if you wear tight non-breathable underwear a lot, or you are someone that sweats a lot down there, or you do not really take note of that moisture, and then you take sugary things, and then your estrogen levels are high, collabo. Collabo. Those are the things that yeast loves, and it will overgrow. Number 5 on the list is immune defense system. Yes, for some people, their defense system, their local defense system is not built to fight candida. Yes, some people they are like that. Is genetic. Yeah. So you see where two people living in the same room, living in the same house, have the same habit. One person does not have yeast infection, but the other person has recurrent yeast infection. It happens like that. It's just genetic, and it's just your immune system that is not built well enough or built strong enough to fight candida. Now, it's not every time that you feel itch down there, that you feel discomfort, that you feel an imbalance that day, that you just assume that is this infection. Yes, that's why I will always advise that whenever you feel an imbalance, whenever you feel some sort of discomfort, you see a doctor, then they'll ask you to run some certain tests, because sometimes the result may come out and it's not yeast infection. There's so many other conditions that may make yeast infection. For example, bacterial vaginosis, contact dermatitis. Yes, contact dermatitis from soap and other things. Yes, other conditions like that may mimic yeast infection, and you'll be wrong if you've been treating it thinking it's yeast and it's not yeast infection. Now, some of you have treated yeast infection and the yeast infection came back, and you just assume that, oh, the medication did not work. The medication is fake. The drug they gave me the hospital is fake. The drug that this person prescribed for me is fake. Sometimes the medication is not fake. It's you that have strong head. Yes, I said it. You have strong head. They'll tell you, take medication for this period of time. Take it for 6 days. Take it for 7 days. Use this for days. Use it for so duration. You, with your coconut head, you use it how you like. You take today, you'll not take tomorrow. You take next tomorrow, you'll not take today. Like that. You take the medication will work. Another thing is triggers. Yes. Wait till cause her before you expose yourself to the same thing again. Like I said, if it's glycemic environment that caused your own before, while you are treating, you are still taking sugary things. What do you think will happen? Is it magic? Then, while you are treating, you are still wearing tight, unbreathable underwears. While you are treating, you went back to see that man. Another reason is while you are treating yeast overgrowth, you are taking antibiotic. Yes, as you're taking antibiotic, the antibiotic is killing the good bacteria down there. You are treating yeast is having more power to grow. Yes. So these are the things that makes you feel, oh, the medications are not working, the treatment is not working, and this thing keeps coming back and coming back. I don't know what I'm doing wrong. Yes, these are some of the reasons why it keeps coming back. So I've already stated the causes. I've stated the reason why some of your yeast infection keeps coming back. Added to medication. Adhere to medication and prescription. Stop behaving like a stubborn goat. Now, I know we've said not to use ash products down there, ash products on your vulva, on your vagina. Sometimes it's really not the ash products. It's just you consciously protecting your natural ecosystem. Just consciously protect it. Don't treat that place like a scratch. Yes. Number 1, avoid douching. I really do not know what you people are washing down there on. I don't know what you people are scrubbing on. I don't know. It remains for us to give on an iron sponge, one as scrub. Avoid douching. It causes an imbalance in your ecosystem and it's not good. 2, avoid wearing tight and unbreathable underwears. Yes. Avoid it. Get cotton underwears. Something that is breathable so your vagina can breathe. Let the vagina breathe. That sexy girl. Let it breathe. Let it breathe. Then number two, control your sugar intake. Control your sugar intake. It's not good as a lady to be eating sweet. You drink, only you drink soda, carbonated drink, only you eat chocolate, only you eat that, all sweet things. Then if you know that you are diabetic, ensure that your sugar level is well controlled. Then lastly, ensure you adhere to medical instructions and ensure that you see a medical personnel as soon as you feel any discomfort. Say no to quacks. Say no to chemists, men and women. Do your ear like this. Say no to quacks. Once you feel any form of discomfort, find your way. Hospital. See a gynecologist. It's not everything that exists. I've said it though. It's not everything that you are feeling that exists. You will go to chemist, you tell them, oh, this one, they will just prescribe one thing for you for yeast. It's not everything that exists. You might be harming yourself, thinking you are doing yourself good. You might be harming yourself, thinking you are doing yourself good. It's not everything that exists. Once you feel a slight discomfort, go to the hospital. They'll ask you to run tests. Is it the money that is paying you? Send me message. I'll send you money. Tell me that you're going to do. I will dash you money. Yes. So please, let's take care of the baby girl down there. Treat it like you treat your child. Treat it like it. Keep it clean. Keep it neat. Help it maintain its natural ecosystem. Yeah. Before I sign out, I'd like you to know that your body is not your enemy. Your body is not fighting you. Yes, recurrent yeast infection is a pattern, and patterns are understood and managed. If we can trace your habits, we can understand your patterns, and we can help you manage it. Yes. So please, no, your body is not fighting you. Understand your body will understand you. Treat your body well. It's what you put inside your body that your body will give out to you. Yeah. So if this episode touched you, if it helps you, share with your loved ones. I know you have a friend or you have a sister that keeps saying, oh, this did not come back again, oh, this did not come back again, oh, it's not a thing of shame. Not a thing of shame. Share this video to them. Let them understand themselves. Let them understand their patterns and their triggers. Do well to share. Do well to like. Do well to subscribe to our channel. Do well to follow us on Instagram. Like, share with your loved ones. Share with your sisters. Share with your besties. Share with your friends. Because sometimes people don't really talk about these things, but it's there. It's not something to be ashamed of. It's something that can be understood and can be managed properly. All right. See you girls. See you boys. I'm Nurse Juanita and I did talk elsewhere. Makes sense.